Hello everyone, welcome back to a new session on dentistry and more. So today we have a new topic, survey procedures. Survey, we have seen survey and we have heard a lot about surveys. The survey which is coming just before the election, that is political surveys, pre-political surveys, pre-election surveys, and survey on various things. So survey is nothing but a part of epidemiology or the descriptive part of epidemiology. So epidemiology, we have two major varieties, that is descriptive and experimental, or you can say observational and experimental. Observational study means the investigator has no special role, nothing but an observer. He just collects data and interprets the data. So survey is nothing but an observational epidemiology. So let's see the definition of survey. It is an investigation in which information is systematically collected, but the experimental method is not used. So like I said, there is no experimental method is involved in survey. So survey is like a common man's term. Epidemiology is more of a kind of scientific term. So the types of survey, we have seen this, I told you, there is no experimental method. So it is nothing but observational part, that is descriptive and analytical. So in descriptive, we are just seeing cross-sectional, longitudinal, and even analytical, we have cross-sectional or longitudinal. So descriptive study and analytical study. Descriptive, as the name suggests, just describe a situation like distribution of a disease. We know it is mentioned under time, place, and distribution, time, place, and person distribution. So analytical means it tries to explain a situation by determinative power, like why does the disease occur? This is like where is this occurring, how it is occurring, how fast it is occurring, and what are the age groups which is affected. So here it is saying why does the disease occur. So here we formulate the hypothesis. In analytical, we test the hypothesis. And if it is based on the time period, we have basically two types, that is longitudinal and cross-sectional. So longitudinal is nothing but a follow-up study. Cross-sectional is only one point of time. We'll be checking the data of a population. Now let's move on to the oral health surveys, that is basic oral health surveys. These are particularly on the oral health matters, that is defined as survey to collect the basic information about oral disease status and treatment needs that is needed for planning or monitoring oral healthcare programs. It's nothing but we do a survey to plan a program or monitor oral healthcare programs. So these are the basic oral health surveys. It has basically few objectives, that is to provide a full picture of the oral health status and needs of a population, and to monitor changes in the disease levels or patterns. So these are the objectives of oral health surveys. So Pathfinder surveys are the common question it's been asked. So Pathfinder survey is nothing but how oral health survey is conducted. So it is for the past 25 years, the practical economical survey sampling methodology by considering special factors associated with oral disease, which is known as Pathfinder. So the striking feature of Pathfinder survey is it uses a stratified cluster sampling technique. We have seen sampling designs in detail. So previous videos I mentioned about the sampling techniques, probability and non-probability sampling. So this stratified cluster sampling technique are particularly used in Pathfinder method. So why we using stratified cluster sampling? It aims to include the most important population subgroups which are having various disease levels, and particular age groups also included. So by this way we can get a very reliable and clinically relevant information for planning a oral health program. So never forget this particular sampling design, stratified cluster sampling, which is particularly for the Pathfinder survey. And Pathfinder survey is for oral health surveys. So we have two types of Pathfinder survey, that is pilot and national Pathfinder. So pilot surveys, like any research, we do pilot study before doing the actual study just to know the feasibility or reliability of the examiners. So pilot survey is just like a pilot seeing from very top of the area, so it can have a very large view, but he may need to do it at a proper level at so that he will understand what are the limitations or roadblocks he might face in the actual study. So pilot study we do on a Pathfinder survey by keeping one or two index ages. So index ages we'll see in the next slide. So it is like we don't take all the age groups, just one or two index age groups, and mostly the 12 years will be one among that, and we do the pilot survey. It will be a very small study. Why we are doing pilot study means it provides minimum amount of data needed to commence planning. Additional data has to be collected in order to provide a baseline for the implementation and monitoring services. So just to start a plan or before planning, we need to do a pilot survey by keeping one or two age groups, and the age 12 should be one among that because it is the global monitoring age of dental caries, and we can start the program. But we need to get more data by conducting National Pathfinder survey. It is a very big type of surveys. It has to include at least 3 age groups, and most importantly it has to include all important subgroups. Here you can use only most important subgroups. So you need to collect people from most of the cities or most of the populations or most of the group where you get the stratified sampling, and clusters wherever you get, you need to include a National Pathfinder survey. The aim is to represent a very larger picture, not like a pilot survey which gives a very minute or very fraction of the data. So National Pathfinder survey, a minimum 3 age groups should be there. Here only 1 or 2 age groups. Okay, so let's see what are the age groups, index age groups I was talking about. These are also known as World Health Organization index age groups or age groups or WHO age groups. So it is important that when we are doing a study on oral health, these age groups should be included because it has relevance in our oral health. The age groups are 5 in number, that is first one was 5, that is for primary dentition, then 12, 15, 35 to 44 and 65 to 74 for permanent dentition. So why fifth year is important? Because the level of caries and primary dentition which may exhibit over a short time frame. So at the age of 5 we have our deciduous molars erupted maybe for 2 to 3 years, so can have a better look on the dental caries pattern. And 12th year is also known as global monitoring age for caries. So because it is the age when children leave primary school, so therefore it is the last age at which reliable sample may be obtained through the school system, because once they are out of the school it is very difficult to collect data. So 12th year is very important. That is why in pilot study we were including 1 or 2 index age group, and one among it should be 12. So teeth have erupted except, because by 12 years most of the teeth must have erupted except third molars, and this is known as global monitoring age for caries for international comparison and monitoring of disease trends. So 15th year, by this age permanent teeth have exposed to oral environment for 3 to 9 years, so caries experience can be assessed. 35 to 44 years, like it is a standard monitoring group of health condition in adults, so the full effect of caries periodontal disease are into action, so we can easily make out or do comparison of the caries and periodontal status between the people. And 65 to 74, this is necessary for planning appropriate care for elderly, and the overall effect of oral health care also can be assessed at this age group. So the index age group or WHO age groups are 5, 12, 15, 35 to 44 and 65 to 74. In pilot study, out of this 5, 2 should be included and 1 should be 12. For National Pathfinder survey, 3 should be included. That is, total 5 are there. So out of 5, there are 3 should be there for a national pathfinder survey. Okay, so how we conduct a survey? It is very similar to our descriptive study. First we need to do the objectives, establishing the objective. Then we need to design the investigation, sample selection, conducting the examination, analyzing the data, drawing conclusion, and publishing the result. So objectives means the hypothesis. We discussed hypothesis, null hypothesis, alternate hypothesis, everything we have covered in detail. So we need to establish a hypothesis. Then we need to design how we are going to conduct the study based on the objective, that is descriptive or analytical. So it can be a prevalence study or it can be an incidence study. It depends upon the nature of disease. If it is already occur, we can do a prevalence study. If it is yet to occur, we can do an incidence study. So incidence study are like issues happening in the future, so it might take longer duration and it might cost a lot of money and administratively complicated, and sometimes we need to keep control. So all these are the patterns which we've seen in descriptive study and analytical study. So we know how to conduct a case control and cohort study, we have seen in detail, so I'm not going very detail about it. So you can always go back and check the video where I mentioned in detail about case control cohort study in the epidemiological section. And then we need to do the sample selection. So selection of sample also we have covered in detail, that is probability sample or non-probability sample. So it depends upon, always probability is good because it has equal chance for all participants, like simple, random, stratified, systematic, and cluster. So in Pathfinder survey, this is a combined stratified and cluster was used, stratified cluster sampling. So non-probability, convenience, judgmental, quota, snowball. So I'm not going in detail because the same topic we have covered. So that was sampling, probability and non-probability. After that we need to do the examination. So conducting examination by approving proper approval from authorities, budgeting, we need to schedule it, and cases refill, validity and reliability of data. So instruments and examination area, all these we need to plan, and then we do examination on patients. So we have 4 types of examination. This is also very important for the exam, types of examination. So type 1, 2, 3 and 4. Type 1 is a complete examination and type 4 is just using a tongue depressor. So always keep in mind, type 1 is the best and type 4 is the worst. Okay, so keep in mind in that way. So type 1 means we have all the arrangements, all the investigations, all the equipments to understand a patient's oral health. We have mouth mirror, explorer, illumination, radiographs, diagnostic methods such as pulp testing, transient illumination, and lab investigation. We have everything to understand a patient's oral health status. But the type 2 is mouth mirror, explorer, and illumination with radiographs. Okay, so type 2 is little bit compromised than type 1. Type 3 is only mouth mirror, explorer, and illumination. Okay, so type 4 is just a screening procedure. We use only tongue depressor. Okay, so type 2 is commonly we use in clinical trials. When we do study clinical trials, we can use this type 2 with mouth mirror, explorer, illumination, and radiographs. Type 3 in epidemiological surveys. When we go to a field, we are doing study on a very large group of people. So in epidemiological surveys, we can use mouth mirror, explorer, and a torchlight for illumination. Type 4 is just for inspection of school children. In that case, we can do. So type 4 is screening, type 3 is epidemiological survey, and type 2 is clinical trials, and type 1 will be a most accurate and most complete examination. So this is types of examination: type 1, 2, 3, and 4. Type 1 is the complete one, and type 4 is the minimalistic one. Okay, so after that we need to analyze the data. How we analyze the data? It is based on the risk estimation. We know how to conduct a risk estimation, relative risk odds ratio. So all those parameters we have seen, and finally we need to reject or accept hypothesis based, and we need to put the conclusion, and we can publish our reports. Okay, so that's all about survey method. Survey method is nothing but epidemiology. In the descriptive part, we are giving in a more general way. Epidemiology is very much scientific way. So we are expressing the same epidemiology descriptive part or observational study in a more common way, that is survey. So survey, the important things are the types of examination and the sampling, and this one, the age groups. Okay, Pathfinder surveys are common questions, and this index age group. So Pathfinder survey, index age groups, sampling, and types of examination. And survey is a very common essay being asked every say 2 years, once in 2 years, or every year it's been asked. So survey methodology and other short notes are important in this chapter. So I'll come up with a new session and then disclaimer. Thank you.